I'm Shiana Watson. I'm an MSW student at the University of Michigan, studying community organization with a focus on health. I've been working in the HIV/AIDS field since about 2007, first as an HIV test counselor, then more recently as a medical case manager. I'm coming to you today to talk about women living with HIV and some of the unique situations that they have to deal with, as well as the federal policies that affect them. And then lastly, what can you do to improve service delivery among women who are living with HIV? So just to give you a snapshot of women living with HIV in the United States, women account for 1 in 4 people in the United States living with HIV. Young women ages 25 to 44 accounted for the majority of new cases in 2010. Also in 2010, among those new infections of women living with HIV, 64% were African American, 18% were white, and 15% were Hispanic. There was some good news though that happened in 2010. We saw a decrease in African American women since 2008. So there was about a 21% decrease of the rate of infection for African American women from 2008 to 2010. So not everything is bleak, but there are some situations that are going on where Black women are disproportionately impacted with HIV and AIDS, where women are not really getting the care that they deserve or that they need, and where women are really getting frustrated with the medical services. So let's look at what are those policies that the government tried to respond once they saw these kind of statistics among women and women of color, and what can we do to improve those statistics. So they came out with, also in 2010, the National HIV/AIDS Strategy. So that's not a law or a policy per se, it's more of a promise. It's more of an outline that the president, after meeting with key stakeholders in the HIV/AIDS community, said that let's have some really good goals to create an AIDS-free generation. And in that National HIV/AIDS Strategy, they outlined some key points to improve linkages to care. So when you do test positive, you're able to access case management as well as medication easier. They also wanted to improve the community viral load. So we know that if someone's on medication, their viral load is reduced. So that reduces the overall community viral load and reduces the possibility and risk for transmission. They also wanted to improve testing, so making testing easier, so testing in non-traditional settings. And so we have all these lofty goals, and it's a kind of a promise that the government kind of wanted to have for the United States to make sure that at some point we have an AIDS-free generation. Really great ideas outlined in the National HIV/AIDS Strategy. And then secondly, we have an older policy that actually is an act. It is a law. It's called the Ryan White Care Act. And Ryan White Care Act, it actually funds all of the HIV/AIDS services that you see in the United States today. So that's prevention services, that's direct care services, that's clinical services where people have access to medication, medical care, transportation to get to those appointments, housing. So all of this is housed under the Ryan White Care Act. So the issues with these policies though, so we have the National HIV/AIDS Strategy, which is kind of the promise to provide the care that people need and the promise to reach out to those high-risk populations and to increase this linkage to care. The issue with those promises is that they really ignore the unique issues of women and reproductive services. As a medical case manager, I've seen this happen firsthand where clients are frustrated with their doctors not really providing or really acknowledging the unique issues that they deal with being a woman. Or I had a client that really was resistant to access gynecology care because her gynecologist, no matter where she went, they always were asking her, well, how'd you get this disease? And she was constantly having to deal with the stigma and be re-stigmatized by other care providers that weren't specific in the HIV/AIDS field. So there needs to be something in that same promise that speaks to training medical professionals to provide gender appropriate services. This is largely ignored in the National HIV strategy. So you may have a woman who has insurance now because of the Affordable Care Act, or they have access to care because of the Ryan White Care Act, but they don't actually act upon those services because of the fear of the stigma, because a medical provider is not really knowledgeable about HIV, or because there isn't care that's provided for them in a way that is accessible and relatable, that is culturally appropriate for a woman. And so this needs to be addressed in the policies of the National HIV/AIDS strategy. It needs to be addressed in the promise that is outlined in that brief. Also, there needs to be an increase in funding in gender-specific programs. Again, women deal with unique issues when it comes to HIV/AIDS. The medication affects them differently. They're also dealing with reproductive issues. They may be dealing with partner and intimate violence. And so all of those things need to be taken into concern and need to be taken into how we approach services. And that's not just medical care services, but also case management. The agency where I work, we are funded for prevention for men who have sex with men because it is a very high-risk population. At the same time, there needs to be prevention services, outreach services that are specific for women as well. But we don't receive funding to do that kind of work and outreach. Also, when it comes to direct care services, we have funding to do support groups and supportive services for all of our clients. At the same time, I had a large increase of women who are living with HIV who wanted more, who wanted to have some sort of a safe space to do self-care amongst other women who are living with HIV and AIDS. We do not have funding to do that type of work, and so the women were able to fundraise on their own and try and get this program off the ground, and we were successful in doing so. But not every agency is successful in doing so, so we need to have some promise with money attached to it when it comes to providing gender-specific services. So not just having it outlined in the National HIV/AIDS strategy, but also having something in the Ryan White Care Act that increases funding that addresses those unique issues that come with being a woman living with HIV and AIDS. So there needs to be designated allocation of funds, whether it's housing, Medicaid funded providers, other wraparound supportive advocacy services that really speak to the unique issues of a woman living with HIV. And so that's what we need to do with those policies. They are great policies that increase linkage of care, keep people healthy. At the same time, women are falling through the gap. So what can you do to make sure that we have a promise that really addresses women's issues, and that we have funding that makes sure that those programs have what they need to actually be enacted in communities? Well, first, make yourself aware so you can inform your friends, your family, your loved ones, doctors, community leaders about living with HIV/AIDS and the need for gender-specific care. So that could be on March 10th, which is National Women and Girls HIV/AIDS Awareness Day, making sure that you have something posted on your Facebook or your Twitter or some social media that speaks to women and girls who are HIV positive, that speaks to prevention programs for women and girls, that speaks to the statistics that impact women living with HIV and AIDS. So just making sure that people are aware of those issues and concerns. Secondly, you should really get involved. So as I mentioned, a lot of my understanding of these policies aren't just from me reading about them and passing them along or reading articles, but also seeing them and directly observing them in the clients that I serve. So before being a case manager, I volunteered at this same agency, the HIV/AIDS Resource Center in Ypsilanti, Michigan. So I encourage you to do the same. So contact your local AIDS service organization. Learn about what they're doing for women who are HIV positive. Learn about the clients that they serve, and also get involved and volunteer. Lastly, what you can do is also contact your senator and contact the people who are over the funding for the Ryan White Care Act. So it is up for reauthorization this year, and recently it was referred to the Health Committee in July of this year. And so they're still debating about whether or not they're going to reauthorize the funding as it's been before. So this is a great time for them to include some things that have designated allocation of funds for gender specific services. So we know the Ryan White Act probably will be renewed. It's renewed every year, which is a huge comfort and assurance. At the same time, it is modified every time that it is reauthorized. So this is your time to contact your representatives, to contact your senators. The representative who sponsored the reauthorization this year is Frank Pallone, and you can contact him and talk to him about the reauthorization of the Ryan White Act, and talk to him about the committee members on the Health Committee about these concerns about designating funding for women. And the Ryan White Act is also known as the HR 2699, as you can see on the slide provided in the video. That's the act that you want to refer to when you're talking about the Ryan White Care Act. So again, what can you do? First, you want to make sure that other people are aware of this. So the more voices we have, the better chance we have of impacting policy. You can find your local AIDS service organization by going to asofinder.com, and you can find your local senator by going to senator.gov. If you'd like to learn more about women living with HIV and AIDS in the United States and what you can do to stay involved, you can learn more at the Positive Women Network. Their website is pwnusa.wordpress.com. They're an amazing organization, network of women who are HIV positive, who do policy briefs, advocacy, as well as just a lot of awareness campaigns about women living with HIV and AIDS, and also provide a safe space for women who are HIV positive to have that support and that network. You also can go to the 30 for 30 campaign. That's also a national campaign of agencies that have been involved in HIV/AIDS work for the 30 years of the virus, and they're advocating for women to have 30% of the funding. Again, funding is necessary to impact a lot of these programs and policies. So these agencies are really advocating for 30% of funding to go to women-specific, gender-specific services. And they can be found on Facebook. Just search for 30 for 30 campaign HIV positive women, and you can find them. Like their page, and you can get updates on what they're doing in their policy and advocacy. Thank you so much for your time, and please leave a comment below, and we can discuss more about HIV positive women, what you can do to improve service delivery, as well as what you can do to improve prevention services.